So I am so blessed to be here today with my beautiful friend Jill, who introduced me to a whole world of HRT that I did not even know existed when I was doing my initial hormone training. And since then, it's been like a trail of Hansel and Gretel leading to one crumb to another to creating this incredible access to information that just isn't available mainstream. So today we're going to be quite specific about talking about HRT and breast cancer because
Mhm.
this is a big topic.
Yeah.
And Jill is the woman to have this conversation with. So would you introduce yourself, Jill, and your journey to the HRT world?
Yeah, yeah. So, well, first of all, thanks for having me. I'm so glad we were connected through somebody else. It's so funny how your paths cross. And we've both been like kindred souls across the pond talking about this
Yeah,
topic that we love so much, just all about education and hormones. So I appreciate you having me. So I'm a
pleasure.
nurse. I've been a nurse for 30, I said 33 years this year. Spent a lot of my time in women's health and never learned anything about hormones, by the way, when I was a nurse. I mean, I don't even know if I had a chapter on hormones or a lecture on hormones. And I actually I worked in gynae surgery, I worked in gynae infectious disease, I worked in reproductive endocrinology and infertility. Did not know anything. I mean, really never learned anything about hormones, which is crazy. And so I actually don't know how I don't know how I fully landed in this, but I think it just was this like curious mind that I always had, even in medicine 30 some years ago, thinking this doesn't make sense. I just always felt like medicine was very reactive. And so over time, I think just years and years and years of experience and questioning and saying what's going on, I started to go down the rabbit hole of hormones. I became a health coach and I was helping women, and everything kept leading back to hormonal symptoms. And I didn't even really put two and two together. It was like these are all seem like they're hormonal symptoms, but I had never heard really, I didn't know the word perimenopause existed. I thought menopause was much later in a woman's life. So this is going back about probably 10 years. And I just, because I'm so curious, I started going down the rabbit hole of hormones and realized, oh my gosh, we've left out an entire system of the body
Mm.
when talking about health and prevention and protection and mood and how we feel and just how we show up for ourselves every day. Hormones are a huge part of that. And I don't think we realize that. So I've just been in
No.
it now for ever since. I just feel like all women need to know, and men too, but I think since we're so focused on women, just want all women at all stages, starting with our teenage girls, all the way throughout life to know how important these signaling molecules are because they are.
And this is the thing, I'm sure there's so many different directions that we could go to in this
Yeah.
call today. But, this outdated view that the only thing hormones are really affecting are pregnancy. Yes, we know perimenopause, but it's all about your uterus. And if we whip that out, you'll be fine. These
Yeah.
are multi systemic, they affect every system in the body. For
Yes.
me, I'm particularly interested around mood and cognitive function and that impact, but just every system. So,
Yeah.
one of the biggest questions that comes up that I think creates so much confusion and fear, because let's be honest, hormones are an emotive subject. They're very
Yes.
emotional for people. They're loaded quite often, particularly if you've not
Yeah.
had a positive experience. So, the big question that we can begin with and unpick it in so many ways, does HRT cause breast cancer?
So where I would go with it is starting with you, and almost like I was saying before we jumped on, I almost don't like the word HRT because it's like it encompasses a whole bunch of things. It could be our body identical hormones or bioidentical. It could mean synthetic hormones. There's so much variation. Our body is so complex, but I would say if we say hormones, do hormones that are balanced and, in the body in the way that they should be, right, in balance, does that cause or initiate breast cancer to grow? And my answer would be no. And I think we have to step back from even hormones and say, the body is every system of our body is it's all about regulation, and we are, if women can think back to when they were teenagers or really maybe in our 20s when we finally had these hormonal rhythms every month, assuming we had, a very regular cycle and we were ovulating. If we think about the fact that we had these robust levels of hormones flowing throughout our body, so made in the ovaries primarily, yes, made in other tissues, but primarily, right, we're making these these hormones in our ovaries, they're traveling all throughout the body. We've got these super high levels that every single cycle we grow a follicle or mature an egg and we release it, and then we have robust amount of progesterone. So think about it, we've got these super, super high levels, and then our body is so brilliant that it knows, okay, if we don't get pregnant, it knows that, we shed a uterine lining, cells self-destruct, breast cells that maybe we were making more breast cells to get ready for pregnancy. We didn't get pregnant. Those cells self-destruct. So we've got this beautiful rhythm every single month of our cycle with very high levels of hormones. And it's just amazing. If we were going to get breast cancer, right? That's always the question. It should have happened then when we had these very, very high levels of hormones. If we're saying we think high levels of hormones cause breast cancer, it would have happened then. We already know that pregnancy is breast cancer protective. Younger women typically don't get breast cancer. There's many factors that go into breast cancer, but to sit there and say it's hormones, it doesn't make physiologic sense when you look back at the history of these massive amounts of hormone levels that we've had in our body. And most breast cancers are diagnosed typically in perimenopause, menopause, really after menopause when hormone levels are at their lowest. So I think we have to kind of look at that. I think where hormones come into play is they are part of a healthy body that has, a regulated system. Like cancer is just really cells have lost their ability. They've lost their normal controls. Regulation is out of control for some reason. What normally would be regulated is no longer. And we can't blame hormones for that. There's other things happening in the body that typically are going to affect our body's ability to lose those regulatory controls. I think hormones get blamed, though, unfortunately.
Exactly.
Yeah,
And I think it would be great to come on to go, well, what are some of the other things that we know are affected
yeah,
breast cancer
yeah,
that just don't get in the spotlight that people are doing every single day without realizing it? But
yeah,
if we know this to be true, that our body is manufacturing this, and it would be common sense to me that our body doesn't want to manufacture something that's going to harm us.
yes.
Where does this narrative come from
Hmm.
around hormones equal breast cancer? Because it's big. You speak to
Yeah,
most women about HRT, they're going to go straight to breast
yeah,
cancer,
yeah.
right? So
Yeah,
where does this come from?
I think it really goes back to the Women's Health Initiative, the WHI, which was a study done in the late 1990s into early 2000s. And they did not use the same hormones in our body. They used synthetic formulations. I call them chemicals because they're not
Yeah,
really even like the hormones in our body. One was Premarin, which is from pregnant horses, the urine of pregnant horses, and one is a progesterone called medroxyprogesterone acetate, which is a synthetic progestin, which is not the
yeah,
same as progesterone. And in that study, and it was only in the one arm of the study where the women were taking the synthetic estrogen and the synthetic progestin, where it looked like there was an increased risk of breast cancer. It was considered like statistically insignificant anyway, which in medicine, if it's statistically insignificant, it's like a mouthful of words I can't say. It's typically, we can't say that that's actually true. It could have been from chance, but let's just say that synthetic progestins were maybe, one of the factors that was highlighted. We do see that with birth control pills that have synthetic progestins, there does appear to be an increased risk of breast cancer using birth control pills and the synthetic progestins seem to be that kind of common thing that we're seeing over and over and over in that conversation. Unfortunately, because of the way, again, our medical providers are not trained in hormones at all. And so the word progestin and progesterone get lumped together when they're two
mhm,
very, very different molecules. One is the progesterone made in our body, and one is progestins, which have very, I mean, almost opposite effects in the body, frankly,
mhm.
than the progesterone made in our body.
Absolutely.
And they can be stimulatory. I never want to say blanket, but they can be more
Mm.
stimulatory to breast cells as well. So that's where it all came from. And from that, it's been hormones as a bucket cause breast
Yeah,
cancer. And and I think once you say it, you can't take it back. It's like it's been let out of the bag, and now no one, still, even doctors are like, well, you can't have hormones because of breast cancer. We're all basing it on that WHI study, and that is just not even the formulas that we use today. So it's
no.
really it's like harmed women's health. It's just
And I think what you're speaking to there is this absolute misuse of the word progesterone is so harmful and so damaging. And
Yes.
in my opinion, really evidences one, the lack of understanding of progesterone. You know, I love
Yes.
progesterone, I'm obsessed with
I
progesterone.
know.
So,
I know.
as an
It's amazing.
example, but for me, you know, progesterone, they don't understand the role of progesterone outside of protecting the uterus. It's
Yes.
so important, but it grows your bones, it protects your breast health. Studies over and again have shown body identical progesterone protects breast health, or at worst
Yes.
is neutral, right?
Yes.
But
Right.
because, as you've said, in the studies, progesterone gets lumped with progestins.
Yes.
So, where we see the studies time and again saying a link with breast cancer, it's not the research around body identical
Yes.
progesterone, but this language gets used. So, and this blows my mind that women will maybe work with you or myself or someone like us and get really informed and understand progesterone. And this could be really supportive for them. Say someone with heavy bleeds,
Yeah.
let's look at vaginal progesterone to support that.
Yes.
We'd go to a GP and say, I'd really like vaginal progesterone. No, we can't give you that dose because it will cause breast cancer.
Yeah.
No
Yeah. No.
evidence of that. In fact,
No.
the opposite we tend to see is true. However, you can have a synthetic progestin coil, which they will call progesterone, where there is actual evidence of link. Make
Yes.
that make sense to me.
No, it's just yeah, there's this like there I don't know what it is that there is just this constant need to like cherry pick these hormones as being bad. It's almost like we want to keep like trying to someone's trying to prove that they're bad. We're going to try to because we see
Yeah.
headlines all the time. We don't see the same headlines with insulin. I can't remember the last time I saw a headline about insulin is bad. And yet, insulin, as we know, excess insulin can actually help promote growth of tumors, right? We
Yeah.
know it does other things as well. That's why we always talk about metabolic health and blood sugar
Mm.
balance and insulin. All hormones need to be it's all tight. It should be tightly regulated in the body. And when things start to go awry, we can start to have issues. But it's interesting that we don't see those same headlines with something like insulin. We know that low thyroid hormone is connected to increased breast cancer risk. We don't see a whole lot about that. Again, it goes
Mm.
back to this whole body regulation and balance. I hate to word use balance, but that we have this synchronous, this sort of symphony in our bodies where we've got enough estrogen, enough progesterone, enough testosterone, enough thyroid hormone, those Goldilocks levels that are unique to
Mm.
us. We're all a little bit different. So it's going to
Mm.
be a little bit different for everybody. But all of those hormones matter.
Exactly. And yet
Yeah.
when just there is this approach, I would love to hear your view, which so many women have, which to me is quite harmful. They find out they've got breast cancer and they're told off your HRT,
Yeah.
off instantly. No, not even titration down, but just told a
No.
hard no, you're off it, and then really struggle. If they say, I want to go back on it, my quality of life is poor,
Yeah.
these are the reasons. And the battle to often keep being told no, they're not having it. What's
Yeah.
your view on that? What's your experience of coming across this for women? Because I know it's something you really
Yeah.
advocate
I
for.
care so much about the breast cancer. Well, I just this whole arena is in terms of hormone health is so important to me, but in particular for the women who have had breast cancer, they are just completely left to fend for themselves. To it's a no, no, gatekeep, gatekeep, gatekeep. And I have a lot of really I've been really diving deep in the last couple of years because I've had a couple of family members with breast cancer. I always cared about it with patients, of course, but I watching people and actually going to the oncology appointments with family members was really eye-opening
Amazing.
because it was just I could see it right away. You're just going to come off your hormones just like that. And I think for women to understand, we've got to take a step back again because if hormone again cancer is about dysregulation. Regulation that was there is no longer there. Cells that were dividing, that were growing, something happened where now there's this out of control growth of cancer cells. And so we want to go back and say, hey, what is happening in the body that the body is allowing this to happen, right? And this isn't a blame. This isn't you
Right?
did something wrong. This is life. This is lack of sleep, it's stress, it's toxins, it's what's in our food and our environment. There might be some genetic components there. We know emotional trauma can all, like, a lot of things can affect the immune system, blood sugar, as we already talked about. But I think that it's been really demonized for women. And so I always say, when you go into this conversation, you don't, you have to really hold your ground, even though it's can be really hard to do, because you're sitting across, usually from an oncologist that's just going to tell you what to do. And what you deserve to have in this conversation, and most oncologists won't have it with you simply because they don't know anything about hormones. So I think they're very, willy-nilly to say, just stop all hormones. If they really knew what hormones did, I think maybe they go, huh, we need to really think about whether or not what we're recommending makes sense for this woman. So I think there should never be a blanket ban on anything. I think what it comes down to is, in this particular woman, whoever's sitting there, going through each hormone individually. What are the benefits of me staying on? Okay, why do you want me to come off estrogen?
Mm,
Right. So, what are the risks of me staying on estrogen? And then also knowing, if I don't use estrogen, what is the risk there? Because we know that there's a downstream effect there. Same
mm,
thing with progesterone. Why are you telling me to come off progesterone? Specifically, why? Is it going to worsen my breast cancer? Is it possible? I want oncologists to say what we know and what we don't know, right?
mm,
And then testosterone. What are the benefits and risks of staying on versus coming off? What are the risks of not using these hormones? And what are my competing risks? So I always think about, a good example, and I've talked to Louise about this, Louise Newson,
mm.
and she has a podcast from several years ago, and I think she brought a patient back, but it's a patient who actually had, before, like, as she was going through perimenopause, didn't realize that her depression was related to low estrogen, and had depression a lot of her life. And so she went on hormones, including estrogen, progesterone, and testosterone. I think testosterone, but I'm sure estrogen and progesterone, and was diagnosed with breast cancer somewhere in there. And she was being recommended chemotherapy and the full gamut of treatments. And she opted to stay on her hormones through the treatments.
Mm.
And it seems very odd to a lot of people, but what she said is, for me, my mood was so terrible. My depression was so severe, that for me, the benefits, like, it was just gonna, maybe it would, like, increase my risk slightly to stay on estrogen, but the benefit of me staying on estrogen for my mood, for her, it was her bones, other things.
Quality of
So
life.
she took it that way, because I think what's the picture that's presented to women is, you must stop hormones, all hormones are bad. And I think what we have to say is, okay, what are the potential breast cancer, even breast cancer? It is true that breast, if it's an ER positive tumor, doesn't mean estrogen caused it, but it means there's a receptor for estrogen on it, which we would expect in breast cells. Those tumors tend to do better in terms of treatment anyway, but that means they can listen to estrogen signals. So there's a thought that, well, maybe we should just quiet those estrogen signals and see if that tumor will shrink. We know from going back through the beginning of when breast cancer was treated, we used to use high dose estrogen to treat breast cancer. So both high dose estrogen and low dose have been used. But there's other signals, receptors that tumors are listening to. Insulin is one. There's a lot of different growth factors. So for a lot of women, if they say, it may, depending on the woman, make sense for her to, maybe she stops estrogen for a period of time, because there's possibility that that tumor can listen to growth signals or signals from estrogen that might make it grow. The other thing is, what about progesterone, right? If we
Mm.
don't see progesterone make, worsening outcomes or increasing the growth as a growth signal, why can't she stay on progesterone? What about testosterone? We've seen in the literature, and we've seen data with Rebecca Glazer, who actually was, I don't remember how long ago she started doing implants, but I feel like since 2004, 2010, she's been publishing. But she's actually put testosterone implants in breasts next to tumors and seen them reduce in size.
Wow.
And she uses now testosterone implants in women with or without aromatase inhibitors, because she realizes that it's so helpful with symptoms in women who have come off of their estrogen. So it's kind of a loaded answer, but I think for women listening, it's like, you know, there's benefits and risks of everything, and you deserve to have a conversation about each hormone in the context of what's important to you. What if mood health? What if you have a strong family history of osteoporosis or osteopenia? Maybe you have it yourself. cardiovascular risk is the number one killer of women. If you have a very strong family history of that, or you yourself, hormones are, it might, you want to definitely have that discussion, because we know that hormones offer protections in all of those areas. And then, of course, they signal all throughout the body. So it deserves a much more nuanced discussion. I think that has just been thrown out the door.
And I love that. And I think I can see, and you may have a different view on this, the challenge then becomes is you're maybe dealing with a clinician who doesn't have the answers to those specific
Yeah.
questions. So you get the
Yeah.
blanket, well, our approach is we stop you on all HRT because
Yeah.
we make an assumption that someone in that role has the depth of training and knowledge to understand these hormones. And
Yeah.
this was one of the biggest illusions and veils that was lifted when I began working in women's health is like, no,
Yeah.
that's not there. And that
Yeah.
is shocking to me because they're dealing with the cancer and they're not trained in the hormones, right?
Yes.
And yet they're giving advice on the hormones. And you will be far more up to speed on the science around this. So I'd love to hear your view.
Yeah.
But my understanding has been of the literature I've read that there is no link with showing that a hormone replenishment,
Mhm.
HRT, causes breast cancer. What it can do is if there's already a tumor there, it can bring it to the surface, making it bigger. And actually, if you've been on the HRT, it gives you better outcomes as a result. That was the last literature that I was across. Is that still the case?
Yeah, that's everything that I've come across as well. And it's interesting, there's a lot of researchers, even when we talk about ER positive tumors, so that just means, again, the tumor has estrogen receptors, which we would expect. What's really interesting about estrogen, and why it just fascinates me so much, is that because estrogen is, more of a growth signaler, right? It's sending signals to grow. The other role, it has many other roles in the body, but in those cells, the other thing it does, because it is a growth signaler, it also repairs DNA. So it has this dual role. So how brilliant the body is that it's like, oh, if we're going to have this hormone that makes things grow, at the same time, we want to make sure it's repairing DNA, so that as things are growing, DNA gets repaired if anything is sort of broken or there's a little glitch there. And so it's so fascinating. I've read studies where it looks like sometimes breast tumors will actually put more estrogen, they'll actually make more receptors for estrogen because they're trying to repair themselves. So there's just so much more nuance to the story of hormones and breast cancer. And I think to your point, if someone has a current breast cancer, maybe they didn't know they had it. And they, like to your point, if you were to then start estrogen, potentially because it is one of many growth signals that the tumor can listen to, estrogen is one, it could potentially make that tumor grow. That is true. And then oftentimes people will say, well, you might find it earlier because it's made it grow. Um, there's just a lot out there's also a lot of really really cool research out there about you know that tumors will adapt. So if you take away estrogen, because cells need estrogen for repair, because they have receptors for estrogen, it's a very important molecule in the body. Cells, if you block estrogen, they're going to go and find another growth factor. And I don't say that to scare women, but what I'm saying is it's this story that women are told that stop estrogen, block estrogen, and your cancer won't come back. And we know that's not true either. Many women have recurrences when they block estrogen for a long period of time or even a short period of time. And that just again goes to show that tumors are opportunistic. And if you block one growth pathway, I always say, like, think about growth factors as like there's a 6-lane highway. Estrogen is one lane. We block the one lane, but there's still 5 other lanes for that tumor to go grab. Okay, okay, no estrogen available. Let's see what else I can grab. Insulin, IGF. There's other different growth factors that can help tumors grow. Tumors want to survive. They'll form new blood vessels. That's what they do. So that's why what I would like to see in these conversations as well is let's look at the terrain of the body, because to tell a woman block estrogen and not have a conversation with her about sleep being so important, immune system health being so important, nutrients being so important, just nutrition in general, blood sugar balance, because we know insulin can be a growth factor for tumors. That is not discussed. And in fact, I
No.
knew from going to chemotherapy with my mom, they were literally, while she's getting chemotherapy, they're handing her like Teddy Grahams, like this is what you're giving her, these, which are like little um like graham cracker, like sugary graham cracker packets
This,
while she's going. And I'm like, what? This just doesn't make
no.
sense. So we have to look at the
Yeah.
woman as a whole and say, does it make sense in each woman? Does it make sense for us to really block hormones? And it might for a period of time, Adele. I'm not saying it
Yeah.
can't shrink a tumor, right? But I think we have to look at the bigger picture. We really do.
Yeah. And again, this to me is that blurring of the functional, preventative understanding of the body that medical practitioners aren't trained in unless they've chosen to access that training
Yeah.
privately. So we have this medical model that is driven by the pharmaceutical industry around here's the diagnosis, here's the treatment.
Yeah.
And there's no further conversation around the role that food companies play, for example, in giving advice. So like diabetes advice, for example, some of the recipes you'll see, I'm like,
Yeah. Does that make
you
sense? Yeah.
there's so much of this going on. And I would love to see so much of a functional conversation. But one of the things that, we're talking so much here about natural hormones and what we don't know, which is
Yeah.
part, in my opinion, medical misogyny, where
Mhm.
women's bodies have not been studied to the depth and the way that we need them to be. But why? I believe there is so much potential in natural hormones.
Yeah.
Again, for me, looking at progesterone with how it supports with anxious feelings, low feelings, not being able to sleep, epilepsy, migraines, all of these things that
Yes.
this natural molecule can be highly supportive for, yet it's not frontline practice.
Yeah.
So, what, in your opinion, why are we not getting this research?
I think it comes down to the current kind of I think the medical misogyny is always a piece where women have been viewed as really not that important to study. Men is what we've been studying since the beginning, and really women were just introduced into research in like 1993 because we're too complicated. From the
Yeah,
medical, right? We're too complicated because we have
expensive.
hormones and cycles.
Yeah,
So I think that's a piece of it, but I really do, and people may have different opinions, but I think a lot of it comes down to profits. It's a profit-driven industry, and I think, unfortunately, I wish that was not the case. That doesn't mean that people in it, like I think a lot of people go into medicine because they want to help people. They're
yeah,
truly healers.
absolutely.
But I think that the framework is, when you go back to how funding works and all of the other things, hormones are not patentable. I know people think they are because they're getting a prescription, but you cannot patent a pharmaceutical company cannot patent natural any substances that are made in the body. We can patent the delivery system, but the hormone itself cannot be patented. So there isn't this desire to put a lot of money into something that is not going to give a big return on investment, unfortunately. And so I think that's why we're seeing more and more, we're starting to see more non-hormonal options, other things from the pharmaceutical industry to address menopausal symptoms rather than saying, let's go to the root cause of the issue, which is hormones. And so I think that's just a huge, huge part of it. It's money. It's not going to be studied.
Mhm.
And to be honest, hormones in a way, they're very difficult to study, and I think that's why the studies in general are hard because even if we do a prospective study, meaning we say, "Okay, today going forward, we're gonna collect" even if we said, "Hey, let's say every center that treated menopausal women collected data on hormones and what their patients were taking, and we all tried to aggregate it and put it together and look at all the information." There's different formulas, there's different doses, there's different delivery, with the types of hormones we're using, right? Body identical, it's hard to compare apples to apples because it's a hard thing to compare because there's such personalization among women and everyone's such an individual, and there's other
Yes.
moving parts. Even in research, there's moving parts that we can't capture in a study. We're never going to know what her personal life is like, what her like all the things that matter for health. We don't capture
Mm.
that in any study, really, right? We have questionnaires that we do and we can do some labs, but the bigger picture of someone's life and what's happening will never be captured in a study. So I don't know that I don't people are waiting and saying, we need more data, we need more data, we need more data. We have to rely on the physiology of the body, what we know about hormones, um, the individual woman, what does she want? Whatever evidence we have for something we can use, but lack of evidence, as I say, or lack of data on something does not mean it's unsafe. It means it hasn't, a lot of times it just means it hasn't been studied and it probably will never be studied. So we have to start getting comfortable with, this is what hormones do in the body. And let's kind of use some common sense logic around
Yes.
what makes the most sense for this woman. And if we
Yeah.
see red flags or something along the way, we can point that out. But it would not make sense to me that we make these hormones in the body and somehow they're dangerous. It doesn't add up.
And I think, what you're speaking to there is something that I could find quite frustrating in the whole hormone replenishment discussion generally, is every single woman in front of you is completely unique in her history, in her lived experience, in her lifestyle, in her genetics, in the whole thing.
Yeah.
So there's lots of people calling themselves specialists in things who look at a flow chart. Okay,
Yeah.
you're taking 2 pumps of estrogen. That's how much progesterone you have. Even if
Yeah.
that woman is sat in front of you saying, X, Y, and Z is happening, I'm not responding. Okay, what does my flow chart say?
Yeah.
And I'm making that simplistic, but it's not that far off that. This is
Yeah.
this set of guidance of tick boxes. I'm not looking at you. And I think that is abhorrent that you're then charging hundreds of pounds for 10 minutes
Yes.
to do something exactly the same as you would get stamped on a conveyor belt through
Yeah.
the UK NHS for free. And I
Yeah.
think there's this, yes, that makes absolute sense. There's common sense to apply. What do we know about these hormones? Because the data may never exist. Is that we
Yeah.
may never get this. Does it? Doesn't it? What's this black and white? Because there's always going to be nuances, right? There's always going to be
Yes.
the individual that's what happens. So we have to take this common sense approach with the hypotheses and knowledge we have about these hormones and apply it to that unique individual in front of us.
Yes.
But the challenge is most prescribers, and I believe it's led by fear
Hmm.
of something might go wrong here. If I
Yeah.
stick with the flow chart and this tick box guidance, then I can't get anything come back on me if it goes wrong.
Yes.
And so you're stuck in these two places of going, I'm empowered. I want this information. I want to try this hormone protocol. I want to try this. And then blocked
Yes.
here.
Yes.
And that's so challenging for women.
It's so challenging. I wish that medicine would also move away from that as well, because I think it's become so cookie cutter protocol, algorithmic, if this, then this. And again, you just said it brilliantly. We are people, we are not algorithms. We can't possibly have an algorithm for each person. Every person would need their own algorithm to decide something. So I think we have to go back to just, again, the patient in front of you, how medicine should be, and saying, there's a lot of things we do. I don't want to say experimentally, but it's like if someone comes in and they have low mood, how often does a psychiatrist say, oh, let's try Wellbutrin. Let's just see if that works. A lot of it is self-experiment, experimentation. And I say that like it's not experiment like
Yeah.
you're being experimented on, but it's like no one is going to know how the woman sitting
No,
next to you is going to react to whatever it is. That's why
no.
we say using common sense and logic, what makes sense for this woman. And I feel like our bar with hormones is so high. The bar with like something like hormonal contraceptives, which aren't even hormones, is so low. You have
Yeah.
PCOS, endometriosis, fibroids, whatever you name it,
Anything.
heavy bleeding, take the pill. We
A
don't even
runny
think
nose. Have
about
the
it
pill.
twice. Yeah. And
Yeah.
it's like that should be that's a whole other conversation of suppressing hormones, which is just crazy that we don't talk about that more. But it's just crazy that we have, yeah, it's this situation where they're so comfortable just handing out antidepressants and hormonal contraceptives and the slew of other medications that are out there, statins, a whole bunch of things.
Mm.
Not to say there might not be reasons to use them, but it's just the bar for hormones is here. And like, oh my gosh, what if something happens? Well, something could happen with any medication,
Those things. Yes.
and
And
going back.
we've got the
Yeah.
data to show it. What you're handing out like Smarties, there is a risk for,
Well,
right?
and then before I
This,
go back with cancer treatments, like they tell women, no hormones for you, right? And if you do that, it's like this, but then they're prescribing chemotherapy and endocrine blocking medications and the things that have very detrimental effects in the body. And somehow those oncologists are not on the hook for that. There's no accountability that to say, because we know with a lot of these, especially chemotherapy, radiation, women have neuropathies, they have a lot of permanent side effects, lymphodemas and
effects.
things.
Mm.
They don't go back to their provider and say, well, you caused this or what you recommended
Yeah.
caused this. Somehow we've accepted that that's an okay risk.
So true.
But now we say, oh, if she wants hormones because she wants to protect her bones, her brain, her blood vessels, her vagina, her mood,
Quality of
her
life.
everything, sleep, her immune system, it's like the bar is so high. It's never made sense to me.
Doesn't. I like so much of this work. I'm like, what?
Mhm.
How is this happening?
I know.
I mean, you touched, and I think for anyone watching this, there isn't a solution to this. I think the best that women can hope for is to have a provider who is willing to get curious with them, who
Yeah.
is open to prescribing outside of the tick box,
Mhm.
and that is the best that women can get, because there are prescribers who will
Yes.
absolutely support. You've got to find them, all right?
Yeah.
That's probably going to be done privately, so there's like a
Yes.
privilege aspect within this. Um, and it does exist. I personally, I'm not an expert on breast cancer, but I do believe that it shouldn't be this. No, come off, just be left in shock of the fear of being given that kind of diagnosis. And then having hormones just ripped out of your body and all like going into the shock of that. It's so much to process. Um, you touched a bit on some alternatives that are being researched by pharmaceutical companies that are coming out. What's your view on these? What kind of things are we seeing coming onto the market?
Yeah, I mean things like Veoza, for example, which is for hot flashes. It's not, there isn't really long-term data on it, and it works in the brain to essentially on temperature regulation control center. And my view is, well, number one, it's very expensive, but it's interesting. If you look at the side effects of Veoza, which is for the treatment of hot flashes, in the top list of side effects is hot flashes, which just doesn't make any sense that you're giving a medication that is supposed to treat hot flashes but can cause hot flashes. It also blocks kisspeptin, which is a very important peptide in our body that actually helps to control cancer growth. And
Oh, I
so,
didn't know that.
interestingly, they did not study Veoza on breast cancer patients, but you're seeing it more and more. You're seeing a lot of menopause people
Given.
come out and say, we're prescribing Veoza, just give the breast cancer patients Veoza for hot flashes. But we're not looking at what it's doing in the body as a whole. Liver markers have to be assessed fairly frequently, which tells you something. There's a lot of liver, potential issues there. Um, I did so this is like dating me, but like 25 years ago, I went back to graduate school and I have a master's degree in health law. And my thesis at the time was on I have no idea why I did this, but it was on the approval of the FDA approval of medications and subsequent withdrawal of medications. And so I went through the whole process of things that get approved and then come off the market because there's all these safety issues. And so I'll be honest, I feel that me personally, in looking at the data surrounding Veoza, I do worry that there are too many side effects and too many things that maybe weren't all some were captured in clinical trials, but in real world, that's where we tend to see a lot of those safety signals. I'm concerned. I also think, it's treating one symptom. And to be honest, when you go through symptom questionnaires or you pull data, and I know we've done this, through the Balance app, I think hot flashes was number 45 on the list of symptoms. So fatigue is like up there with number one, right? Mood changes, sleep,
Yeah.
all those things. And
Yeah.
Veo's is not going to help that. And if anything, hormones are the things that help sleep, the immune system, our mood, a lot of
All
those.
needed for healing, right? If
Yeah,
you're not sleeping at night,
you're
you
not.
take away a woman's progesterone, which is getting her at least a good 8 hours sleep,
Yes.
and you go, no, you can't have that. And sleep vanishes. How is your body meant to heal? How is your body
Very
meant to
interesting.
recover?
Yeah, and it's interesting. When I was at the conference a couple weeks ago, one of the topics that was brought up with a dermatologist actually in the UK, which I thought was a brilliant conversation for him to bring up, was looking at women who have their breast cancer removed, right? So they have a lumpectomy or typically a mastectomy. I think this group had more mastectomy and had breast reconstruction surgery, who were on aromatase inhibitors, so blocking estrogen while in surgery and then after surgery, had far poorer outcomes in terms of more infections, more wound healing issues, just a number of like implant issues. And so, again, it goes back to this benefits versus risk discussion where maybe, right? So maybe you're decreasing estrogen because you're worried about tumor growth. And yet she goes in for surgery for her tumor and now her wound healing, and she may have more complications. So I think we have to just think much more broadly about what these hormones do in the body and not have these just blanket
Yeah,
no, sort of recommendations because it's not serving women.
no, it
Yeah,
really isn't. It's really, and I see the women in clinic and they're like, what do I do?
I
What
know.
do I do? So can we leave women with what can they do? Maybe at a time where
Yeah.
they feel completely powerless, they feel like they're just hitting walls, they might have done some self advocacy and not got anywhere. In this situation, what can women do?
I mean, I think women have to know that you have a choice in whatever you do. Whatever your provider recommends, whether it's the oncologist recommending it or it's a hormone provider or someone else, you always have a choice. And I think this is where the getting educated about your body is really helpful because you don't have to know what we know, but to understand what hormones do. I think that when you walk into that conversation, I think you can say, I think being ready to say, hey, whoever it is, to whatever physician or provider, I understand what you're saying to me about why you want me to come off my hormones. Here's why. I'd like to look at each one individually. And I'd also like to look at the risks that are important to me. My mood health matters. If that's important to them, I think that is something that they should feel like they can have a conversation with their provider about. And then ultimately make a decision for themselves on what feels right to them. There is no guarantee, no one will ever be able to guarantee that by doing this, you will not have a recurrence risk later down the line with breast cancer or anything, right? We can talk about any
Yeah,
cancers for that matter. There's no treatment that is going to guarantee that something won't come back. And I think this is
yeah.
where you go back to like just knowing what they're recommending, understand whatever they're recommending, understand the benefits and the risks of those treatments, as well as the long-term effects in your body from those treatments. So just I think it's having a really complete picture of benefits, risks, side effects, long-term risks, not just today. Like for example, if you're doing chemotherapy, they'll tell you, and not everybody, but nausea is very typical for many types of chemotherapy. Hair loss is there, right? Fatigue, lowering of your white blood cells. And so they have this kind of plan in place to address the things that you're going to have side effect wise. But what they don't typically tell you, and this happened with my mom, that later down the line, there are other issues that you can have immune system wise. So now she's developed an autoimmune disease. Those are the conversations you want to have now. What are the benefits and risks of what you're recommending? The side effects right now, but also later, what do I need to be aware of later? And then also go through those hormones individually. What are the benefits and risks of each of those hormones? Why you're recommending me to come off them? And they need to have a reason why if you're going to come off of
Mm.
them. And then I'm not using them. So at least you've got the picture, and then you are in the driver's seat to say, this makes the most sense to me because you're the only one that can really make the decision. I know women want someone
Mm.
to steer them there. I think you understanding the oncologist's limitations and knowing hormones, knowing anything about hormones, you might have to then seek the help of also a menopause specialist and get maybe both sides to go, what
Mm.
makes the most sense for me? And I know that's a lot,
Yeah,
but we would do it for our kids. I always say we will
yeah,
go to the ends of the earth if it comes to our kids. We will
so true.
like push down doors to find a specialist for our child or go to the ends of the earth. And I know funds are, everything costs money. I get that. And so I'm not at all insensitive to that. I too am trying to be very
Mm.
budget conscious, but I think put yourself up as a priority. Know that like you're having the information up front is going to be so much more helpful to you to get to have these consults up front. And then you'll be able to
Mm.
make that decision that's right for you.
I love that. And I think, God forbid I'm ever in that situation. I can imagine knowing my nervous system, I might just go into like
Yeah.
freeze,
Bring
and this is
someone with
where
you too. Bring someone
having
with you.
someone with
Sorry. Yeah.
you to
Yeah.
say, can I'm trying to process this diagnosis for myself. Can you be the calmer reflector? Because we know when we go into a fear state, we're unable to physically access the part of our
Yes.
brain that is able to assess risk and be logic, right? We're
Yes.
just in panic mode,
Yeah.
understandably. So if you've got someone with you who can have that conversation, because I think when we become frightened and we become vulnerable, very understandably so, we lose that ability to critically think. We just
Yes.
hand our power over and say, just fix this, just help me, because we're frightened. I mean, we saw a lot of that
Yes.
through COVID, people just just tell me what to do. So being
Totally.
able to have someone who's going to have your back, be by side, and say, we've got some questions, and to lead on that. And sadly, the fact I
Yeah.
even have to say this, but the research shows that when women take men to an appointment, a medical appointment with them, they get a lot better
They
outcome.
do. Yeah.
We shouldn't even have to say that, but the research
It's true.
supports that. So it's like actually really building in this support to be able to get the best outcome for you. And I think being able to say, can I just pause on this? can I just give me a day? I need to process this. I don't want to make this decision right now. That you absolutely have the right to say, I just need a minute to process this. I don't want to make a
Yes.
rash decision. And I think we feel like we're not allowed to say that. And
A
you
hundred.
are,
I
it's
was
your
going to just
body.
say that. Yeah, I
Yeah.
was going to mention that too. I'm so glad you said it. Don't rush the decision. I think it's presented as it's an emergency, and I know when it's your body, it feels like, oh my gosh, it's growing. Like if I don't do something, it's growing. But most breast cancers are not fast growing breast cancers. You can take your time. I'm not saying to take months and months, but honestly, take the time you need to make the decisions. And I always say during that time too, going back to the foundation of your body and knowing that your body can heal. Our bodies are capable of reverting cancer cells to normal cells again. I mean, our body is so brilliant.
So
And with
clever.
the right inputs, right, we can get our body back to a place. And so it's just not rushing the process and knowing that you've got this, you can do this. I know it's overwhelming. But having that person with you, yes, especially a man, because they will typically listen, having your questions there, and even sometimes calling in advance and saying, if you have that initial conversation, just saying, I already know that I'm going to need to schedule a follow up to go through these points in more detail.
Yeah.
And you may have to pay sometimes out of pocket for those. It depends, but that should always be part of the treatment
Mm.
program anyway. How can anyone make a decision in this very short period of time?
It's
Sitting
so
with it.
big.
Yeah, it's a big
Yeah.
decision to make. Yeah.
Mm. Yeah. Jill,
Yeah.
I've loved having you here. Thank
Oh,
you so much for coming and just having the conversation. It's not because there's this magic answer, because
no.
as we said, everyone is so bio unique, and there's a lot of challenges out there that women have to
Yes.
overcome across the board with hormones. But I think just knowing that there's women like you there advocating for this and so knowledgeable and creating a safe space to reflect on different aspects that might not be available to everyone, I think is so important. So
Oh,
thank you for the work you do, and thank you for being here and having this conversation with me.
oh my gosh, thanks for having me. I love having these conversations. I just want women to feel empowered to advocate for what they want and what they need and not to feel shy or feel like they have to kind of cower back because they have a medical professional sitting in front of them. Like they live in their body and they know their body best. And at the end of the day, you're in your body every single day. Your medical provider is not. So it's so important to you for you to feel really good in whatever decision you're making.
Absolutely. And Jill, how can people find you and your work?
Yeah, I mean, so I now, I'm working on the Balance app, which is, it's was founded by Louise Newson, and we're doing a lot of education there. I'm actually going to be doing, we have a lot of plans for it. So I'm spending a lot of time in the Balance app myself, writing a lot of articles. We're doing more videos, we're doing Q&As. We're going to have a big breast cancer series in there coming up as well, which will be very helpful, which is really addressing all the things we've talked about today. So that will be there. I'm on Instagram, and I do tend to post there. I have a website. I stopped seeing patients last year because I really wanted to shift the focus to just education now. So typically, I would just say in one of those places more for education than anything.
Amazing. Thank you so much for everything that you do. I so deeply appreciate you.
Thank you.